Let's talk about infectious mononucleosis, also known as glandular fever. Infectious mononucleosis or IMN, is an acute febrile illness caused by Epstein-Barr virus. Epstein-Barr virus is transmitted via saliva and aerosol, and majority of the population is exposed to the virus in the childhood, and remains asymptomatic. It is mainly a disease of the young adults or adolescents. This virus targets the squamous epithelium in the oropharynx. It can also target circulating B lymphocytes, which then causes a lifelong latent infection. Symptoms. More prominent symptoms are fever, malaise, headache, sore throat. There are some characteristic features to look for, to make diagnosing easy. Petechial rash, especially if the patient had received ampicillin treatment. Cervical lymphadenopathy, especially posterior triangle. Splenomegaly, mild hepatitis. Rare symptoms can be seen sometimes which can be serious. Meningitis, encephalitis, myocarditis, mesenteric adenitis, cerebellar ataxia and splenic rupture, and the patient should avoid contact sports for 3 weeks. Rare manifestations of infectious mononucleosis include: if the patient's having underlying rare X-linked lymphoproliferative diseases, it can cause severe or fatal IMN. In AIDS patients it can cause oral hairy leukoplakia. EBV virus can also cause a rare condition called hemophagocytic lymphohistiocytosis. Diagnosis. Full blood count will reveal lymphocytosis. Peripheral blood film reveal large atypical lymphocytes with irregular nuclei. These can occur in other viral infections as well. Serology tests are particularly useful for accurate diagnosing. Anti-EBV IgM antibodies indicate a recent infection. If anti-IgG is positive, it usually indicates past infection. Look for heterophile antibodies, with Paul Bunel test, or monospot test. Checking viral PCR. Treatment. Majority recover rapidly within 2 weeks with supportive treatment. Instances where corticosteroids are recommended: encephalitis, meningitis, Guillain-Barré syndrome, marked thrombocytopenia, hemolysis, severe tonsillar enlargement. Epstein-Barr virus is a non-oncogenic virus. Rarely, latent infection or chronic active infection, which often target circulating B cells, can give rise to several cancers, such as Burkitt's lymphoma, Hodgkin's lymphoma, gastric cancers,